Hi, and welcome to this video where we will be discussing infertility related issues associated with polycystic ovary syndrome, commonly known as PCOS. PCOS is a common endocrine disorder that affects many women, almost 20%. It's characterized by hormonal imbalances that can result in various symptoms, including irregular periods, acne, weight gain, and one of the most significant issues associated with PCOS is infertility, which can be a devastating and challenging experience for women who are trying to conceive and start a family. As a doctor who specializes in treating women with PCOS related infertility, I understand how overwhelming and frustrating this journey can be, always searching for answers and not really getting anywhere. However, I'm here to reassure you that there is hope, and with the right treatment, many women with PCOS can conceive and will conceive and have a healthy pregnancy. So, the first step in treating PCOS related infertility is to understand your individual case. Um, Now, PCOS affects women differently, and your treatment plan needs to be specifically tailored to your specific needs. I find that there's a tremendous amount of missed education, good education, not so good education, but it needs to be tailored to your specific needs and what you should be doing. So you do need to seek the guidance of some specialists, sometimes fertility specialists, sometimes just regular OBGYNs. And this can be incredibly beneficial. They can do a comprehensive evaluation of your hormonal profile, your ovarian function, and other factors that may be impacting your fertility. In addition to medical treatment and medical follow-up and diagnosis, there are many lifestyle changes that can actually help improve your chances of conception and ovulating first and foremost. For instance, maintaining a healthy diet and exercise and improving your weight and improving your hormonal balance can increase the chances of ovulation. Now, there's a lot of things that you can do and that have been proven in the literature to different types of exercise and different types of diet. Um, you'll read one paper that says intermittent fasting, and you'll read one paper that says intermittent, keto. And I find it to be a little bit frustrating, to say the least, when when you're getting all this information that's coming at you all different ways, and you do it for 5 days or 5 weeks, and it doesn't help, and it continues and continues, and so it's very important that you have to find something that works for you and work with your healthcare provider to make sure that you're tailoring this properly. So diet, nutrition, exercise is also very important. Different types of exercise help. Someone says cardio, someone says HIIT, someone says weightlifting. I mean, again, there are things that have been shown to improve and things that show not to improve, but the large studies show really any type of exercising that you're getting on a regular basis. And again, remember, it has to be something you like and something that you're doing. Stress management techniques. Okay, why that's important? Because we do know that PCOS is associated with higher risks of depression and anxiety, and so you need to improve your mental well-being. What that means is getting enough sleep, bringing down your anxiety levels. There are techniques such as yoga, meditation, other counseling can also improve your stress levels, and that has been shown to impact fertility. Just remember that PCOS-related infertility is not your fault. It's a medical condition that can be managed with the right approach, and with the help of your healthcare team, you can take the steps towards achieving your dream of having a family and becoming a parent. So if you are struggling with infertility related to PCOS, don't give up. Seek the guidance of some of these specialists, of your doctors. Talk to them. Make the necessary lifestyle changes that need to stay committed to your treatment plan. Because basically, if you do things that aren't going to make a change, then they're not going to do, not going to help you on your journey. A couple of the things that we've had in terms of great effects on ovulation and on menstrual health is supplements, different type of supplements, and we talked about in the past about inositol. We talked about chromium, cinnamon, um, berberine, red yeast, turmeric, coenzyme Q. All of these are affecting insulin resistance, inflammation, and help get your um, adrenals healthy. These are all different causes of PCOS, and these have been all shown to improve menstrual regularity and ovulation. I had one patient which I started 3 months ago on inositol plus. She was not ovulating, she was not menstruating, and now she shows up and says she wants to conceive, and she wants to have, get pregnant. And sure enough, we tried to get her regular. We tried to affect change. I started her on the powder, and within a month, she was regulating. She had in 3 months, she had 3 periods regular every 28 days. And I thought it was wonderful, and she was really thrilled by it. She didn't conceive yet, but then I said, let's make sure that you're ovulating at the right time, you're intimate at the right time, and making sure that there's doing the right things. So the first step, obviously, is assessing the patient, making sure we understand that there's different reasons for infertility. It could be she's ovulating, but a much less frequency. And sometimes there's blockages in the tubes, and sometimes it's the male factor. You can't ignore that as well. Before we give medication, we always check the male factor to make sure that there's enough semen and sperm that are motile enough. So we're really excited about this inositol plus. I've had some really incredible results based on the inositol plus alone, and so I always recommend, don't get your healthcare advice and guidance from the internet or even from Amazon Plus or Live. You should talk to your healthcare practitioner. Make sure you're making the right choices in life. But we do know that lifestyle changes that can make massive, massive amounts of long-term positive effects. Um, Love to hear more. If you want to jump on the chat, send me messages. Provationlife.com. You can order here or on Amazon. Provation Life is the way that we can communicate with you. And there's a lot of education and individualized, personalized answers there. When you text us, we write back immediately. So it's exciting. It's something that I want patients to be obviously healthy. I want them to be in their comfort zone, so to speak. So come along for the ride, and looking forward to uh, starting a conversation with you, finding out more information if you're interested, and so stay tuned. What I would recommend would be following this page, because I'll be putting out these, what we call these PCOS minutes, where I'm giving a little bit of updates here and there on things, recent papers that I've read that'll help you on your journey. Good luck.